Howdy! Whenever someone has heartburn, Prilosec, also known as omeprazole, is a go-to medicine. But what exactly does Prilosec do? How does consuming Prilosec actually reduce our pain and get rid of that burning sensation in our heart? In this video, we will explore the causes of heartburn and peptic ulcers that Prilosec treats, as well as how Prilosec functions as a mechanism to treat these diseases, its effects, and its initial discovery. To begin, let's look at the diseases themselves. Two of the most common issues that Prilosec aims to target are peptic ulcers and heartburn. When you think of heartburn, what do you imagine? You might think of clogged arteries in the heart, and you wouldn't be alone in that popular misconception. Heartburn, however, is the burning sensation caused by acid reflux, and acid reflux is when the stomach acid, aka hydrochloric acid, backs up into the esophagus. The esophagus is located just behind the heart, and so the burning sensation is often associated with the heart when it is in fact pain in the esophagus. Similar to heartburn, peptic ulcers are caused by an overproduction and secretion of hydrochloric acid that is present in the mucosa. This causes an erosion and lacerated area within the mucosal layer of the stomach. These diseases can arise from eating excessive amounts of fatty and acidic foods, stress, smoking, alcohol, and non-steroidal anti-inflammatory drugs such as aspirin and ibuprofen, also known as NSAIDs. NSAIDs act by inhibiting the COX enzyme. COX is responsible for the production of prostaglandin E2 and prostaglandin I2, aka the ligands responsible for inhibiting hydrochloric production in both the parietal cells by binding to receptors on the cells and promoting mucus and bicarbonate production in mucous cells by binding to receptors on its cells. When COX is inhibited, the result is an overproduction of HCl as the factors responsible for regulating it aren't produced, which in turn leads to the damaging effects of acid in the stomach and the esophagus.
Now that we've discussed the disease, let's discuss the treatment and how it works. Prilosec is a proton pump inhibitor that works in parietal cells. When it reaches the lumen of the stomach, it forms covalent bonds with cysteine residues via disulfide bridges on the alpha subunit of the hydrogen-potassium ATPase pump. This stops the pump from using ATP to pump hydrogen out of the parietal cell and potassium in. Since this is the final step of hydrochloric acid production, Prilosec suppresses both basal and stimulated gastric acid secretion, allowing for the prevention of acid reflux. The inhibitory effects of Prilosec occur rapidly within 1 hour of administration, with the maximum effect occurring in 2 hours. The inhibitory effects last for around 72 hours after administration, followed by a return to baseline activity in 3 to 5 days. With daily use of the medication, the effects will plateau at 4 days.
Okay, so we are now going to be discussing some of the side effects of omeprazole. Now, as we all know, no side effect reading would ever be complete without some nice distracting background images. So some of the common side effects of omeprazole include diarrhea, stomach and abdominal pain, headache, nausea, those can both occur, and vomiting. Some of the more rare side effects that can occur while taking omeprazole include osteoporosis, vitamin B12 deficiency, and in very rare cases, acute kidney damage, although that has happened before. So we're going to be discussing one of the most common symptoms of omeprazole, which is diarrhea. So this is believed to occur because, as we all know, omeprazole, what it does is it raises the pH of the stomach acid by inhibiting the hydrogen pumps inside the stomach. And so what can happen with that is that leads to less efficient digestion of food, which means that some undigested food can end up in the intestinal tract. And so it's possible that that alone can lead to irritation in the intestinal tract. Another reason that undigested food could lead to irritation is because since the stomach acid pH is raised, that means it's easier for bacteria to enter into the intestines. And along with having that undigested food, it means there's more fuel for that bacteria. So it means there's a greater chance of stomach acid infections from bacteria such as C. diff or salmonella, and that can occur. Another possible reason that omeprazole could lead to diarrhea is because omeprazole is a hydrogen pump inhibitor, and there are hydrogen pumps inside the intestinal lining. And some research is suggesting that those hydrogen pumps inside the intestines, they play a role in colonic fluid secretion. And so by inhibiting those pumps, it could lead to diarrhea because that's related to the retention of fluid inside of the intestines.
So another symptom we notice with Prilosec is going to be headaches. Now, we know that the main ingredient of Prilosec is omeprazole, which which is mentioned previously, is a proton pump inhibitor. Now, these proton pump inhibitors actually can cause something called hypomagnesemia. Now, I chose this little red devil in the bottom corner because he has a fallen halo on him, which is a good representation of what magnesium in different amounts can do to your body. Being in low amounts, it can be detrimental, and normal amounts, it can be beneficial. And so, as we notice, it's going to cause loss of Mg2 plus absorption via a transient receptor potential called melastatin 6 and 7. And so, unfortunately, whenever we don't have enough magnesium, it's going to stop the prevention of the narrowing of brain blood vessels caused by serotonin. And so your brain is in consistent need of blood, but whenever it's dilated, it's going to create something called a vascular headache, and that's how you sort of get that pulsating feeling. And this is ultimately what leads to headaches caused by Prilosec.
As mentioned before, Prilosec is known to be a proton pump inhibitor that blocks gastric hydrogen potassium ATPase and inhibits gastric acid secretion. The root of the discovery and mechanism of this drug goes back to the 1970s when it was discovered that the potassium hydrogen ATPase in parietal cells was the last step in acid secretion. Further screening led to the discovery of an anti-secretory compound called tomoprazole, which appealed to scientists due to its simple chemical structure and high level of anti-secretory activity. Later in 1979, a derivative of tomoprazole called omeprazole was discovered. Soon after, a Swedish pharmaceutical company called Astra AB, now known as AstraZeneca, started the production of omeprazole, and it became the first of a new class of drugs that had the ability to control acid secretion in the stomach. In 1980, omeprazole was filed for an investigational new drug application, and in 1982, it was taken into phase 3 human trials. From these trials, it was concluded that omeprazole was clinically superior to the histamine H2 receptor antagonist. Thus, in 1988, it was launched as an ulcer medication in Europe and the United States under the name Losec, but at the request of the U.S. Food and Drug Administration in 1990, the name of the drug was changed to Prilosec to avoid confusion with the diuretic Lasix.